Yes, I would take the easiest case now, which is case 7. Case 7 was a very straightforward case. Somebody who has had diabetes for 7 years with poor control over 1 year. And over the time, one of the things I realized from here is that especially lack of follow-up, and then the referral system has not been very good if you look at it. And then starting with sulfonylureas and going again with sulfonylureas, increasing sulfonylureas, and straight away from sulfonylureas now they go now to insulin, to insulin bedtime, and then increase it. And then when you look at the past history, is no history of coronary heart disease, hyperlipidemia. There is no history of uric acid increase in the gout, peptic ulcer. The past history was very clean, except that the patient was smoking for 30 years, of 30 cigarettes, no history of drinking, which means you must bring that in. And you must also talk about cessation of smoking if you want to prevent atherosclerosis or cardiovascular disease. Marital status, nothing of stress in the family and nothing. Family history of diabetes, which is important. But when you look at the physical examination per se, in fact, it was virtually unremarkable when you look at it. So you see it like a old case, but new to treatment with no complications. So you have really an uncomplicated case of diabetes mellitus, and you can see that it is not type 1 diabetes per se, because some people put autoimmune disease or young type 1 diabetes, type 2 diabetes. And then the GAD antibodies, the C-peptide, glucagon-stimulated C-peptide measurements, Doppler readings were only bilateral popliteal artery plaque formation. So, and there are no signs of retinopathy if you look at it. Most of my comments were related to, in terms of follow-up. Most of the cases, most of the doctors did not talk about monitoring of a close monitor. This is a patient who has been missing from follow-up, which means you must follow up complete monitoring. And someone talked about referral to education, but not insisting on physical activity. One of the doctors managed the case very well, but I think one of my comments again is close monitoring. You can see from here that when they say at least 150 minutes of moderately intensive physical activity per week, no non-nutritive sweeteners, alcohol 1 drink per day, smoking cessation, update vaccination, you understand who is the doctor here. You know, limit the amount of calories to fat to 20 to 50%, this. And then the other thing I noticed from some of the answers was in terms of nutrition. They didn't mention anything about the nutrition of the patient. And then again, you could see here about, and my comment here is again, physical activity. Some of them did not make physical activity. The difference I see here is the diabetes care team. We didn't see most of the people with the diabetes care team bringing in the care team into consideration when you have more. So here they just talk diabetes department of endocrinology, but you have patients which you have to screen for renal disease, you have to screen for cardiovascular disease, so you have to look at the podiatrists. So this is a case where you have to bring in more subspecialties so that the diabetes care team will manage the patient. And that is what some of the weaknesses I saw on this case.
Okay, thank you. Thank you very much, Dr. Jean-Claude.